2026 Joint Health and Wellbeing Strategy. This is the final update before we move on to the new Joint Health and Wellbeing Strategy, which is currently being developed alongside a refreshed JSNA, both of which are due to be published in April 2026. Sorry, has it moved on to the second page? Oh, yeah, there it has, sorry. Okay, so to recap, the 2022 to 26 Joint Health and Wellbeing Strategy had 6 priorities. It was to give all children the best start in life and support emotional and physical health from birth to adulthood, promote mental health and improve the lives and health of people with mental ill health, create opportunities for individual and community connections, enabling a sense of belonging and the awareness that someone cares, keep residents safe from COVID-19 and other infectious diseases, improve years lived with good health and happiness, and collaborate, plan and secure funds for local and national emerging new health and wellbeing priorities. So the first 5 of these were broken down into further priority action areas, which is what I'll go through in a moment. This slide just shows the governance structure and which board and committee has a statutory responsibility for ensuring the strategy and JSNA is in place, and which boards and forums are sponsoring the current priority areas. So over the following slides, I will provide an update on some of the key indicators which we use to show whether or not the work we are doing is making a difference to our communities. This link on the page at the moment will take you to the dashboard, which contains all the indicators and has the latest data updates. So this table shows 4 indicators related to happiness and well-being, and is linked to the outcome looking at improving personal well-being and happiness. So this is linked to priority 1. Over the past few years, the average rating for life satisfaction has stayed fairly stable at 7.6 out of 10 for life satisfaction, and has risen slightly to 7.7 out of 10 for happiness. The level of anxiety has reduced from 3.5 to 3 out of 10, which is very positive. However, the average rating for feeling worthwhile in life has gone down from 7.6 to 7.6 out to 7 out of 10. This slide shows local survey results of students in years 5 to 13 experiencing high levels of symptoms of anxiety. This is children and young people aged between 9 and 18. We haven't got data for all year groups in 2021. However, the data for 2023 shows that between 33% and 46% of all students in those years surveyed to have high symptoms of anxiety. And not surprisingly, a higher proportion of year 11 and year 13 were reporting anxiety. These were the GCSE and A-level/applying to university years. Overall, there's been more than double the rise in children experiencing high levels of anxiety, from an average of 14% in 2021 to 36% in 2023. And then this slide again shows local survey results of students in years 5 to 13, but this time experiencing high levels of symptoms of depression. Again, there are missing data for certain years in 2021. However, the average percentage reporting experience of depression are slightly higher in 2023 at 20% compared to 17% in 2021. And then the data in this table is linked to the outcome, looking at reducing the feeling of being alone and excluded. The table shows the local survey results for the percentage of pupils in years 5 to 13 who said they often felt lonely. From 2021 to 2023, there was generally been a reduction in most year groups of the proportion of pupils who said that they felt lonely. And so this is a summary of the 10 priority actions that are in priority group 1, giving the best start in life. All of them were completed or became business as usual, or were decided to be continued into the new year, and had all been achieved by February 2025, which you would have been given an update about back in February. So the key point I wanted to note about this priority area were the emerging and new actions. So there's a continued need for focused support to help parents build attachment, engage positively and actively play and interact with their children. And there is an ongoing action to understand the reach of the 0 to 5 offer across BHFT, Home Start and early years. And moving to priority 2, which focuses on promoting mental health and improving the lives and health of people with mental health issues. This table is related to the outcome for reducing self-harm in children and young people. It shows hospital admissions due to self-harm broken down into ages 10 to 14, 15 to 19 and 20 to 24. We haven't had an update in the data since this was last presented to you in February, but just as a reminder, the data we have shows that hospital admissions rates due to self-harm were increasing across all 3 age groups and was particularly high in the 15 to 19 year age group. The data in this table supports the outcome increase in the number of schools promoting mental health and well-being. Again, the table hasn't been updated since it was last presented to you in February. However, in the updates I received for the action tracker, all but 2 primary schools now have access to the mental health support team, and those last 2 schools will have access from December. So hopefully future updates of this table will show an increase across the 4 indicators. And then this table is linked to the outcome reduce smoking in people with mental illness. As you can see, the number of people with mental illness who have successfully quit smoking at 4 weeks has gone up from 2021-22 to 23-24. However, the percentage quitting is similar in both years. This indicates in 2023-24 there was a higher number of people with diagnosed mental illness accessing the smoking cessation service compared to in 2021-22. So when I worked it out, there was an extra 50 people that had accessed the service, so about 75 in 2021-22 compared to 124 most recently. Of the 12 priority 2 actions, 11 had already been completed, become business as usual, or were continuing into the next year, and one of them had been paused. So the key ones that I wanted to note was the mental health awareness training had been delivered to a wide range of frontline staff, retail, voluntary and community sector, citizens advice, DWP, and the council frontline staff. Schools have been supported by the whole school approach to reduce eating disorders. Professionals are working across community, schools and local authority. Professionals that work across those areas have been offered training based on behavioural insights reports to reduce eating difficulties. And the evidence-based intervention provided to young people is a low-intensity CBT. There is still work ongoing to improve the children and young people and parent experience of navigating the system to get support for people with eating disorders. And in terms of new actions, there are talks underway with maternity to link the Stop Smoking service and midwifery to support pregnant women to quit smoking. And then I mentioned that there was one action that had been paused, and that's the Pan-Berkshire Multi-Agency Self-Harm Toolkit. There needs to be a decision made on this toolkit and how it would work. And then moving on to priority 3, which focuses on creating opportunities for individuals and community connections. This table has 6 indicators related to community assets and how they are used to connect to local activities. Whilst the number of community assets hasn't increased from the beginning of 2024-25 to quarter 3, there has been triple the number of views on the community map, showing that there's good engagement. There's also been a rise in the number of people who have signed up to the newsfeed, the number of frontline professionals who have been trained, and the number of training sessions that have been delivered. And this slide is from the Public Health Social Prescribing Service. Whilst the number of referrals have increased, the number of people attending social prescribing events have decreased. 3/4 of the referrals are due to loneliness and social isolation, and the activities these people are prescribed has helped 85.3% feel less lonely. Of the 10 priority action areas, 4 were already completed and 6 are ongoing. The key results to note for this priority action area are that community spaces were determined to be better than libraries for community learning settings, and warm spaces have been scrapped, and the focus will now be on a winter and summer timetable for interventions in the community spaces, and residents are continuing to sign up for Green and Active. Moving on to priority 4, this priority focuses on keeping residents safe from COVID-19 and other infectious diseases. The indicators in this table are linked to the increase in the uptake of routine screening. The newborn physical examination screening is currently at 96.7%, and the newborn hearing screening coverage is 99.5%. Both are consistently high year on year. A concerted effort has been made to increase the uptake of bowel screening since 2021, whilst breast screening coverage is stable year on year. Abdominal aortic aneurysm screening coverage has also increased year on year. So all 5 of those screening programs that I've just mentioned are all achieving coverage above their national targets. Cervical screening coverage in 25 to 49-year-old females is currently 70.3%, whilst it is 75.5% in 50 to 64-year-old females. This is below the target of 80%. And chlamydia screening in females aged 15 to 24 years old has reduced year on year and is currently 12.8% that has been screened. The indicators in this table are linked to the increase in the uptake of vaccination in eligible populations. Since the February presentation, data updates have only been available for the DTaP, IPV, HIB and MenB at 1 and 2 years old, and the DTaP and IPV booster at 5 years old. And these all show the uptake rates are similar year on year. Again, the data for this table has not been updated since the February update, but to summarise, for MenB at 1 year and rotavirus at 1 year, the vaccination uptake rate is close to the national targets of 95% uptake. However, for the MenB booster at 2 years old and the HPV vaccine doses for males and females, we are below the national targets. Of the 7 priority actions, 3 are completed and 4 are ongoing. The key actions to note are the adverse weather plan has been completed, and Gabby is working with colleagues across the council on winter and hot weather preparedness. The screening and immunisation programmes will be transitioning to Frimley ICB from April 2026. And then the last priority we'll be looking at is improving years lived with good health and happiness. So the outcomes considered in this table focus on smoking cessation and NHS health checks. So during quarter 4 of 2023-24, 158 people were supported to set a 4-week quit rate. Of these, 111 had successfully achieved a 4-week quit, meaning 70% of smokers had successfully quit at 4 weeks. This is a similar proportion to previous years. The NHS health check data shows that the offer and uptake in the targeted population was considerably higher in 2023-24 compared to 2021-22. The targeted population were male, aged 50 to 75, current smoker, had high BMI, was a carer, had a CVD high risk review, and had been referred into the service. The uptake of the NHS health check in the universal population, which is all eligible residents aged 40 to 74, was similar between 2022-23 and 23-24. So with all the 11 actions for this priority, 4 were already completed, 5 are ongoing, and 2 have been delayed. So the key things to note were the CSU have been commissioned to produce needs assessments for 4 key priority groups. That's the routine and manual workers, residents in deprived areas, people with serious mental illness, and pregnant women. And then the new actions to know include new clinics offering targeted stop smoking services have been commissioned across Bracknell Forest Council area to increase uptake among residents affected by smoking-related health inequalities. And then there is currently a review of the physical activity and weight management offer as well. So just to finish, I want to summarise that a lot of the actions had already been completed or become business as usual or ongoing actions by the February update. All the responsible officers, services and teams involved in these services have made great progress to achieve the priorities in the strategy, and to do so at least a year before the new strategy is due. Of the 50 actions, only 2 had been delayed and 1 paused, which is a testament to everyone who has been involved in achieving the targets set. So that's the end of my presentation. Does anyone have any questions, or would they like to comment on anything?
If you could take the slides down, that would be great, so we can see each other. So has anybody got any reflections or questions from that presentation? Charlotte?
Thank you. Thanks so much for that helpful run through, Sita. I suppose I'm edging into the next section, but my reflections are on certain points that Sita's made, and for us to keep in mind in terms of the refresh for the strategy moving forward, and also what we want to focus on as a board. And again, I'll come into that in the next agenda item. There was just a few things in terms of the dashboard that Sita summarised within the slides. We're really conscious that the accessibility for the board themselves and actually wider partners in seeing those metrics is still posing a challenge. So we have actioned to ensure that that dashboard is pulled into the Joint Strategic Needs Assessment. And that we will look at making that wholly accessible across the piece. So that piece of work is going on. In terms of the specific priorities, I think around priorities 1 and 2, for me, in some of the data and those outstanding actions may warrant a continued focus for us as a board within the strategy on children and young people, in particular in relation to the mental and emotional health and wellbeing. Public Health have commissioned that school survey again this year. It's not Oxwell, it's My School, My Health, I think is the term. And that's an enhanced version of the Oxwell survey. So we will get further insight into that worrying upward trend in levels of anxiety and poor mental health in the school setting. So we will have more in-depth knowledge and understanding for us to craft what it is we want to be focusing on within the strategy moving forward. The other point on children and young people is that we've got the Best Start in Life policy and the work that Cherry's spearheading and leading on. Really keen to align that, or at least complement the emerging neighbourhood health programme of work to focus on that as a system. And we might want to consider as a board which elements of it. I know in particular it's been a constant sticking point, the self-harm toolkit, but are there certain elements within that Best Start in Life and the wider mental health for children and young people's agenda that we as a board want to drive forward and really focus in on in unblocking some of those challenges that we've experienced to date? In relation to priority 3, the community connections priority, I just wanted to flag to the board the success of the community map has been really encouraging, and so I joined a conversation last week, actually a wider Bracknell Forest Council organisational conversation around the learnings of that community map, and is there opportunities to broaden this out across Bracknell Forest Council services more broadly, and even possibly on a wider system level in terms of Bracknell Forest as a place. We do obviously incorporate the voluntary sector community offerings there, but can we look at NHS services and the like? So conversations are already being had on a much bigger scale in respect to that. In respect to the public health social prescribing service, and the data that was presented, I just wanted to highlight I'm currently supporting Councillor Wright in taking the decision to cease the service, which may feel at odds in terms of the good practice that we've presented. That decision has been made in terms of the public health funding of such a service, not currently in line with the grant conditions, and also there is a universal social prescribing offer in primary care that's funded through our PCNs, and so we've done an extensive piece of system working to begin to coordinate that social prescribing community resilience building piece as a system, rather than small services offering ad hoc bespoke services, that actually we need to change as a system as to how we support and build resilience in there. So aligning that to the thriving communities piece, the community strategy that Abby's going to talk to later. So I just wanted to highlight that will change, but we are conscious of those universal offerings and using public health funding so that it really delivers most value for money. And then finally, just in terms of priority for health protection, I think moving forward there will be a role, there's a statutory duty for the Director of Public Health and then to the Health and Wellbeing board around being assured in terms of health protection across the system, but we do have our health protection board to delegate to oversee that. So I think that we can look at what doesn't necessarily need to be so prescriptive. That's one for us to observe as a board, possibly, rather than drive as we have done, which was appropriate given the global pandemic. And then finally, that priority 5 for me, what's flashing is the obesity levels. I'm hoping it's a blip, but there is a serious upward trend at the moment. And if that continues, then we do need to have a focus as a board, I feel, on looking at that whole systems approach to tackling the upward trajectory of obesity. The weight management offer is something that's on the forefront of our agenda within public health and that will be addressed and needs to play into this, but it's not the only answer to this upward trajectory. We need to look at the wider environmental risks and what's driving some of that, as well as the education piece and the empowerment piece within local communities too. And I'll pause there.
Thank you. Any other comments or reflections from anybody else before I give a couple of my own? Okay, and as you say, Charlotte, my comments lead into probably the next section, and in no way underestimate the amount of work that has taken to get us to where we are now. And this is, I guess, a challenge for us as a board. I wonder if we're being ambitious enough in our what we're setting ourselves to do if we manage to achieve most of the things by February. So I think that's just that balance between setting achievable things and also being ambitious enough. Secondly, I do wonder how honest we are with each other about admitting when things aren't going well and things aren't delayed. And I did wonder if whether some of the narrative around and it's going to continue into next year is actually where we've come across delays in things that maybe as a board and as seniors leaders we could have addressed and moved onwards. So I just think whilst celebrating all that has been achieved, as we go into our reforming of how we work as a board and into our strategy for next year, I think there's perhaps some things to observe. And the final thing that I observed when going through it was just how difficult it is to make judgments about progress when the data is a year behind where you're actually at, and whether there's and how we're going to deal with that going forward, and maybe think about proxy measures and things when we know things are only measured on an annual basis. So those were just some reflections from me. So Charlotte, do you want to come back on any of that?
Yeah, and I exactly, and I completely agree with your points. And just to, I suppose, move on to the final bit of this agenda item, which is the forward look and the plan moving for the refresh of the strategy. We have commissioned FAST to support that piece of work, both the refresh, the co-design piece and the rewriting of it, as well as the joint strategic needs assessment. And I think, Nicola, your point on proxy indicators and what we're monitoring within that dashboard can all come into that piece of work. So it's a real opportunity for us. For a change, the stars have aligned in that we're looking at the refresh of the board and its forms and functions, along with the opportunity to refresh and learn, and picking up your points, Nicola, on where there have been possible delays. It may be a delay, it may be that actually when we re-looked at the size of the ask to do it properly, the timescales needed to shift. So it will be for FAST to understand that, and for that to be incorporated into the learnings and the refresh of the strategy as well. So I think between the JSNA, the strategy, and the review of the board's form and functions, it's a real opportunity for us to set how we want to operate for 26 and beyond.
Yeah, exciting times. Welcome those who've just joined us. Charlotte, was there anything you wanted to say more about the new strategy refresh, or do you want to go on to your second agenda item, which was about the health and wellbeing board discussions and how those are going?
So in terms of the strategy refresh, we're in the process of mobilisation with FAST, and they will be in touch in due course in terms of further engagement with board members and with your organisation. So it's just really a plea to engage in that process and be part of that, and we will set out the full timescales to you all in due course. And then shall I, Sita?
Sorry, I thought I'd just add in there, if that's okay. We are hoping to get the stakeholder list to them in the next week, so they should be contacting everyone in this board in the coming weeks, next 2 weeks. They're hoping to have a workshop in early February, and also further workshops with residents and other key stakeholders in I think late February, but they will hopefully be in touch with you in the next 2 weeks to get those dates in your diaries, because we know that you're all very busy people. So they do know, and it's on their agenda to get in touch soon.
Thank you, Sita.
Yeah.
Charlotte, did you want to move on to the update about the Health and Wellbeing Board discussions?
Yeah, so this is a verbal update. Board members, vast majority of board members came together on Monday with our local government association colleagues who have been undertaking a review of our board's form and functions. We had a really productive morning together, where we reflected on the interviews that they had undertaken and those findings, as well as looking at what good looks like elsewhere in the country in terms of both how boards operate, the governance that sit around those boards, and the strategies that they're working to. Some key headlines for us, I think, that came out of those discussions. It's going to be really key for the strategy moving forward to be very specific and not over challenged in terms of the number of priorities that it focuses on. FAST were there in the board in that discussion, so they heard all of these discussions and points that were raised, and have that as a really good grounding for launching their approach to the refresh of the strategy. I think whereas we looked at a whole 6 priority areas, and it was very detailed and quite prescribed within our current strategy, I think from the conversations had, the new strategy will look quite different, and will enable us to, as a board, really determine our roles and responsibilities as to what we want. They use 3 terms. It was drive, sponsor and observe, and I think all of those around the table on Monday really liked that approach, where we could be very specific in what we are choosing to drive as a board, and what we just need to be briefed on what we are sponsoring to happen as business as usual within our organisations. I think we had some really insightful conversations about how we want to structure ourselves and how we want to work together. All the notes will be written up and circulated to board members. So I'm not going to go into too much detail here and now, other than you will receive all of those. You'll receive the full slide deck and the reflections on the interviews as well in the next by the end of this week. And the next steps will be for Nicola, Councillor Wright and myself to come together and to look at what can be implemented in the short and medium term, and what actually we want to explore in the longer term coming together. And our next board meeting, we will have a dedicated time and space within the agenda for us to discuss that and to agree as a board the changes that we wish to make.
Thank you, Charlotte. There were other board members there at the session this week. Is there anybody else that would like to add anything to Charlotte that they particularly took away from that session, or any observations that they had? Or we'll pick Sue.
Just in addition to Charlotte's comments, I think one of my reflections is a term that was used to drive, sponsor and observe. I think that really landed with a lot of partners around the table in how the Health and Wellbeing Board can add value to the place going forward, and how it will link in with the strategy. So I think I agree with everything that Charlotte has said in terms of its productivity and the value that it's added. And I think now, looking ahead, looking at the emerging new ICB structure, I know we're still waiting for guidance on neighbourhood health plans, but I think it is a really timely time, for want of a better phrase, is really timely to be having this conversation, to reset and make sure that we are feeding into what will be a new strategic commissioner come April. So lots of opportunity, I think, sitting behind the work that Charlotte and the team have been doing.
Thanks very much, Charlotte. And I think the next agenda item is mine, so we'll move on to that. And that's about NHS planning. I get all the exciting topics, don't I? So I think you've seen a set of slides, and I'm not going to run through those. I'm going to assume that you've read them. If you haven't read them, you might want to have a look at them afterwards. I thought what I would do is share some of my personal reflections about the way NHS planning and policy is going, and how that might particularly be relevant for the Health and Wellbeing Board. And then I'm going to open it up for other people's reflections on what they've read in the planning guidance, and any other questions that you might have. And I'm only going to cover 3 points, you'll be pleased to know. So the first reflection I had was how important it is for the Health and Wellbeing Board to note that the NHS is trying to move towards a multi-year planning cycle and financial settlements that cover multi-years. And I was thinking about how much perhaps we've focused our own strategy on an annual cycle as well, a bit like the NHS does, whereas a lot of things that we're trying to do happen over multiple years. And I guess one of the reflections from me is how we can align our thinking around the Health and Wellbeing Board with the direction of travel that the NHS is trying to get to, and local government has had for a while, which is about thinking of planning not just in annual chunks, but in multi-year cycles. And so that's one of the things, just to note, that the NHS is trying to change to think medium and longer term as well as short term. So that's just a first observation. My second sort of narrative is the importance of both and. The NHS planning guidance always has a both and component that's important to understand and see. So partly planning in the NHS is around the must-dos, those political commitments that have been made, and the things that are really important to populations in terms of performance and improvement. So the same things have come through the planning guidance as we've had for a while, and you'll notice that. So reducing waiting times, improving access to general practice, making sure that when people have an emergency, they can get care quickly. So, and then also for the NHS, being in financial balance. So that imperative about understanding our money, getting the NHS finances on track, making sure that the NHS is making absolute optimal value from the resources it gets. So a lot of NHS planning is in that space of NHS performance, financial performance, and care quality. The both and bit is that planning is also about wider things. It is about and slide 19 in your pack gives some of those wider things. It is about a continued commitment to reducing inequalities. There's a real imperative within the planning guidance to move from just illness to prevention, and that huge focus on neighbourhood health and connecting with our populations. And I guess my plea and my challenge to the Health and Wellbeing Board, again for us to pick up in our strategy and the way the Health and Wellbeing Board works, is please be patient to us as an NHS as we're having to achieve those micro targets that don't necessarily connect with you and partners. In your own organisations, you'll have the equivalent of that to yourselves, but we must do those things. By doing those things well, it gives us the freedom to get into the more exciting areas, which is around the partnership working, the shift to prevention, etc. And please don't assume if all you hear from us is around waiting times and GP access that we're not interested in those other things. We genuinely are. It's a both and for us. And I think the Health and Wellbeing Board can really help us within the health community to keep focused on the and bit and to remain ambitious at the and bit in case we get distracted by NHS England's focused on micro NHS performance targets. So we really need you to help us in that space on behalf of the population. And the third thing is just how important your skills are, those of you who work outside the NHS, in delivering those things that are in the plans that are broader than just the NHS. So that reduction in inequalities piece, the prevention piece, the neighbourhood health piece. And just to reflect that the role of the Health and Wellbeing Board as the pinnacle locally of partnership working is very, very clear in NHS planning now. There is a hand being reached out to Health and Wellbeing Boards to say, you are the place, you are the forum of leadership where partners are brought together around geographies. Please step into that space. We'd ask you to lead the work around neighbourhood health plans. And I think that's a real call to arms for us as a Health and Wellbeing Board as we reset how we work and as we reset our strategy, that not only in policy terms, but in terms of structural redesign of the NHS and ICBs becoming much larger organisations with fewer people, there is that leadership partnership space for Health and Wellbeing Boards to step into. So those were my three observations, thinking about what we're trying to do over a longer time frame, not necessarily just a single years, doing the both and, the stuff that the NHS has to do around performance, but also those wider exciting things. And then just the hand that's been reached out to health and wellbeing boards as the pinnacle of local partnership and the opportunities that brings. So that's my personal observations of what NHS planning could mean for health and wellbeing boards. But I'd really like to open up the conversation to any questions you might have on the slides or what I've said, or other people's reflections on how the NHS planning framework might be changing and shifting the landscape and what that might mean for health and wellbeing boards. So any thoughts from anyone else? Sue.
Nicola, thank you ever so much. And local authorities for some time have been lobbying government to get 3-year settlements, funding settlements, for the very reason that you can plan far more strategically. You can look at the medium term and understand where you need to make investment or changes now to have the effect and achieve the outcomes that you're looking to deliver in that medium to longer term. So very much supportive, and it very much aligns with that narrative around that health planning. I think really mindful of how I think organisations and the system has got used to that annual turnover of activity, and the how you need to do things in a different way to be able to plan longer term. And there is a shift then in terms of how you manage and mitigate risk. There is a shift in how you justify investment. So that sort of thing doesn't happen overnight, but that's where this conversation, as you say, is so important and will unlock those opportunities. And I think it really does give us that sort of leverage to make that left shift, that prevention, and focus on the areas that we need to, particularly in light of the conversation and the points that Charlotte's just raised around where the Health and Wellbeing Board will focus its time. Oh, you're muted, Nicola.
Charlotte.
Thanks. Thank you, Nicola. And actually, your reflections echo mine. I think in terms, as I was reading through, the sort of the ambitions that are very clearly set out in terms of that shift to prevention and the neighbourhood health delivery of that pace, etc. And then you go on and you look at what you're going to be held accountable to. It's sort of heart sink a little bit, and I do feel for you. But I again, ever the optimist, I just think there's a real opportunity here, like you have described, to look at the role of the Health and Wellbeing Board and the governance and the infrastructure and how we set ourselves up with some of this delivery to broaden that out and to realise what you said. So I'm not saying anything that you all haven't already covered, just to support and to say that I'm aligned with your view on that. I did have a question just in terms the final slide about developing our commission plans, and I was just wondering if the infrastructure has or the governance arrangements has been scoped yet as to how those commissioning plans are going to be developed for the Thames Valley, and do health and wellbeing boards play into that so that we are cited, or and so then we can understand actually where might we want to look at broadening out and what our role might be.
Yeah, if I just come in on that before Alex comes in. So the Thames Valley cluster, so Bob and Frimley are doing planning together this year as one organisation to be. The deadlines have been as ridiculously short as they ever are, and the first draft of the numerical plans is going in this week. There is a commitment to reach out to partners, both providers, because it's largely been, the narrative piece has largely been an ICB piece of work so far, and to partners to engage you in those planning conversations. the final drafts and narrative plans don't go into February until February, so there is some time. So Charlotte, I've already prompted the planning team to ask where we're up to with that, but I will do that again to make sure partners have an opportunity to influence and shape those plans. Alex.
Thank you. So it's great to be back into a medium-term planning framework, because 6 months, a year, trying to do anything strategic and other than kind of tread water and just firefight and respond has been distressing, actually. So it's really good that we're getting into medium-term planning now. And I'm speaking as a NHS provider partner member, and the point about pinnacle of partnership and the opportunity for our partnership here is massive. It's the 10-year plan for health, not the NHS, and there are some very important cues for the NHS where we are expected to shift the focus of our resources, and particularly as a mental health and community provider, towards proactive, preventative care delivery for our communities in partnership. So this is about the synergy that we can get from our partnership in a much more integrated way. We are expected to show in our planning how we, the NHS, are going to move into that space. And I think the accountability we'll have to the Health and Wellbeing Board is really important. So it's the and stretch, as Nicola says, is there, but I think we're being driven right into that space, quite rightly, to support our communities better in partnership, which is a very different planning lens for the NHS and an exciting one.
Thanks, Alex. Anything else from anyone else? Hopefully we'll be able to involve you in some of the conversations about the health plans going forward. But a really exciting time, and as Charlotte said, the coming together of a refresh of our strategy, the refresh of how we work as a Health and Wellbeing Board, and the shift in NHS policy and planning is all coming together at the same time. Gonya.
Yes, just to say, just want to bring your attention, Nicola, to the event on the 17th. So in terms of how we're all operating together, I think the development of strategy continues, doesn't it? Even though there's so much change and movement in the combined space. So, for example, on the 17th of December, I've received an email today about Dying Well strategy for Thames Valley. So, in terms of those commissioning priorities and what that might look like, there's already that ongoing collaboration and engagement across the broader footprint, engaging local authorities, both operationally and from a commissioning perspective, in ensuring that our voices are heard within those plans as they're starting to emerge. Just thought I'd share that because I'm not sure who's cited on that.
Yeah, thank you. Sue.
Sorry, Grania, my sound went, and I heard the 17th of December, but I didn't hear what it was. The critical point.
1 minute, just let me get back to it. Dying Well strategy for Thames Valley.
Oh, right. Okay, thank you.
Yes, an end of life process from a commissioning perspective to look at
okay.
what those pathways and journeys need to look like in order to meet the needs of that broader footprint in terms of population.
Yeah, lovely. Thank you.
Great. Thank you very much. Well, there's no other comments or reflections, we'll move on, and I'll hand over to Claire, who's going to give an update about the Health Watch annual report. Over to you, Claire.
Thanks, Nicola. Thanks, everyone. Just bear with me whilst I share some slides.
That's all good. Thank you, Claire.
Great. So if it will allow me to go full screen, if it's feeling kind. Hurrah. Okay. So this is very much a whistle-stop tour of the work the team carried out April 2024 to March 2025, which is the period for our last annual report, which was published in June. There is much more detail in the full report, so do read that afterwards if you would be interested in more detail. I should say all of the work carried out was before I was in post, so I will do my best to talk eloquently and not bore you to tears by reading off the slides, but just for awareness, I would normally hope to kind of give a bit more of a richer discussion, but I'm sort of reliant on what the team have told me about what they did. So, oh, it's going to let me go to the next page, bear with. No. Here we go. Okay, so in terms of our numbers, the people that we supported, those who shared their experiences with us, the work done there, this is measured through a variety of contact pathways and touch points, including use of our 3 websites, well, in this case, one website, our Bracknell website, social media, direct in-person interactions with the team on the ground, and also contact with our hub, which is our advice and information service via web forms, email, telephone, and surveys conducted. So it's a huge number of people that we've sort of come across over the year. 10 reports, and our team made up of 6 members of staff and 13 volunteers. So some of the work carried out last year involved engagement at Wexham and Frimley Park hospitals. That's still ongoing because we found that that's a really useful way to connect with people on a variety of different challenges and opportunities. People are always willing to talk to us, and they will be accessing healthcare services for a variety of different issues. So that's work that's ongoing for us and still proving really impactful. Another one example here we have is Bracknell Care Home, who were not well connected with community dentistry, so we supported them to make some links to dental care for their vulnerable residents. And we also supported at the Frimley primary care briefing, which involved leading a discussion where GP practice staff were sharing ideas around how to improve experiences for dementia carers. There was also a piece of work carried out around supporting people with learning disabilities, and the team were essentially advocating for more joined up care and follow through for people who weren't necessarily accessing their health action plans. So those are just a few of examples of how Healthwatch engages with the public and supports them to overcome barriers to receiving high quality health and care support. We had and still have really positive partnerships with our colleagues at the ICB, which genuinely makes our work more effective and impactful when it comes to collaborating on sustainable change. So long may that continue as we move to a new Thames Valley system. The same goes for our neighbouring Healthwatch in Surrey and Hampshire, who we will still want to keep really close ties with as we look at also new opportunities to work with Healthwatch in West Berkshire, Oxfordshire and beyond with the changes that are coming, and of course continuing to work closely with our commissioning partners at Bracknell Forest Council. We're a member of the ICS System Quality Group, and last year and continuing into this year have shared quality and intelligence reports in this space, as well as case studies of residents' experiences of care and support provided by Frimley services. So this is really useful for us and continues to help us ensure that patient and public voice is at the centre of quality improvements on that front. And the Frimley Reconnect, Reset, Rebuild project was a really nice opportunity to hold a range of group discussions and feedback key themes to the ICS to inform the health and wellbeing priorities, some of which have obviously just been discussed, looking at the strategy refresh. So people's experiences of care helps us to know what's working and what isn't, so we can provide feedback to services and help them improve. So public and patient experiences will shine a light on issues that may otherwise go unnoticed. So an example of this being carried out last year was the team championing community concerns to improve access to primary care for dementia carers. And they also undertook a really interesting piece of work. There's a full report on this to dive into as well if you haven't already. That was around finding out if the accessible information standard was being delivered as it should be to those residents in East Berkshire who need accessible information, and the team found out that it wasn't, and service providers have committed to improving this. And that report also includes a really comprehensive patient story, a deaf resident's account of issues that they were having with accessible information. So hearing from all communities being a key part of the work carried out last year. A core part of Health Watch's work is proactive outreach to those whose voices may go unheard for various reasons, to gather insight that may help combat health inequalities in the community. So 2 examples of this last year were hearing from people with macular degeneration and what their priorities were, for example, improved transport, and also focus groups that were carried out with Nepali women who we knew were part of a wider group of women of South Asian ethnicity who were underrepresented in the National Women's Health Strategy. So that the team tell me was a really insightful and interesting afternoon, which then went on to form part of the Women's Health report. And that piece of work was undertaken in partnership with Bracknell Forest Public Health team. So our volunteers, they are key for supporting service delivery, informing our priorities and acting as our kind of eyes and ears on the ground, which I realise makes them sound like spies, but they're very friendly and willing spies. So this is just a few bits of the work that they carried out last year. We've just conducted our last enter and view visit for the year, which was in Slough, but we've done 2 in Bracknell Forest, and also we have a group of volunteers on our strategic advisory group who support us with our priorities and strategy and kind of share their specific insight and expertise and hold us to account. Yes, so going back to our enter and view project, and I should say we're currently considering our volunteer recruitment strategy for 2026 across all of those areas. But yes, enter and view, we get lots of really positive feedback from care homes that this is a really helpful experience for them, particularly those that may be in between CQC inspections. As we know, there can be quite a long wait in between, and the home might have made really big improvements since the last one. So as well as sharing resident feedback, we will also share examples of best practice that we've noted at other care homes, where sometimes really simple tweaks and adjustments have had a big impact. For example, using contrasting colours for toilet seats to make bathrooms more dementia friendly, and things like adding really simple planters to garden spaces so residents can get involved with growing herbs and vegetables. So we always produce a summary report with recommendations and comments from the providers. We then go back to revisit and follow up on the progress. So we're carrying out revisits now, and that will continue into next year for these care homes. So the Women's Health Project, the majority of that project was carried out last year. It was published in August, but the majority of the project work took place within the previous year, and it was carried out over a full year. It took time to get it right and make sure that there were translated materials and interpreters available for focus groups. But as you can see, we had a really, really good response via the survey and the focus groups and other community engagement that we carried out to seek women's views on local NHS services, and a real mixture of feedback. Do read the full report if you haven't done already. But lots of positive experiences, but also challenges around GP access and waiting lists. And I mean, in response, Nicola, to the comments you were making about changes you're having to look at, GP access and waiting lists come up time and time again for us across the board. So they're really important areas to be working on. Lack of information, not being listened to, having those dedicated resources and culturally sensitive information. There was really strong support for the development of women's health hubs, which was one of the reasons that this report was and this project was scoped off the back of the national strategy and what we were hearing in the community at the time around a real desire for integrated, community-based holistic services. So we will be following up with Frimley, ICS and NHS Foundation Trust next month to hear about the progress they're making against our recommendations. And we're also working with the DAO's interpreter service around some opportunities that have come up to potentially create further translated resources for gaps that were identified. For example, some Nepali women not understanding the process for booking interpreters for GP appointments, and also understanding what's available to them free of charge when it comes to NHS services. So we're working with Frimley and also primary care around what's already available and what can be sort of easily translated on that front. So moving on to our future priorities, we find ourselves in the slightly strange position of needing to plan for the year ahead in line with these top 3 priorities that have been identified by East Berkshire residents via our What Matters Most survey, but also needing to consider possibly winding the service down in that time. The Department for Health and Social Care have advised us that they are working towards March 2027 for the new directorate to be set up and Health Watch to be abolished. And there has also been a local contract tender process with mobilisation currently being planned and agreed with our 3 commissioners across East Berkshire. So the current provider of the contract, Help and Care, will retain the contract after December, but we won't be confirming our work plan just yet. We will do that in January. But yeah, these are the top 3 things that came up for us, and there's lots of potential things that we've already discussed that we can work on and engage with the public and do some interesting work, not necessarily looking long range because of the national situation, but there's still things that we can do looking a bit more short term. And that's all from me. Thank you for listening. If anyone's got any questions or reflections.
Thank you so much, and it gives me the opportunity to say what a wonderful job you do on behalf of us all and our residents, not just being their voice, and doing wonderful constructive challenge, but also being a really good partner. And I don't know how you managed to do all those 3 things, which can be counterintuitive, but as an organisation, you did such a good job, and we're really thankful that we have you as a partner. Philip.
Lovely, thank you, Nicola, and thank you, Claire. I guess the challenge for us is, irrespective of the direction of travel with Health Watch and what happens in terms of commissioning for the future, these are priorities because they're informed by people, and we mustn't lose sight of that. So actually, as a Health and Wellbeing Board, we must remember that these are priorities of our population, and therefore it's what we do with that intelligence and how we assist, irrespective of what the services look like into the future, how we have those voices heard, and how we reflect our residents. So I just wanted to say that it's a kind of challenge back to us, really, as a board, I think.
Yeah, absolutely. And thank you so much for your comments, Nicola and Charlotte. And we do, you know, we do have to take that position of when we have suggestions on the sorts of things that perhaps we should be working on that are off the back of national reports and intel that's coming through, you know, left, right and centre. We will cross-check whether we've been hearing about that in our conversations in the community and in our discussions. You know, we can only focus on what is being shared with us and then act on that. So I think sometimes there is a feeling of, oh, but it's strange that you're not focusing on this, and it's because we are first and foremost informed by those local voices. Absolutely.
Which is why you're so valuable, Claire. Is there any comments for anybody else or any reflections? Can I just double check those 3 priority areas? Are they specific to Bracknell Forest or to East Berkshire in totality?
It's East Berkshire in totality. We did break the survey results down into the 3 separate areas. They were broadly, there was some slight differences. I mean, in some areas, for example, children's mental health came up before adults, but primary care and waiting lists were top 2 across the board.
Yeah. Well, the reason I was asking is I think as leaders within our own services, and of course through our health and wellbeing strategy, we can take that feedback from our residents about what's important to them. I'll let our planners know in Thames Valley that that's come through our Health Watch for East Berkshire, but equally there'll be other forums that partners may be in, and it's incredibly useful to know what are the priorities for the residents across East Berkshire and in Bracknell Forest. Okay. Thank you so much, Claire. And Gronny, you're next up, talking about the Safeguarding Board's annual report.
Yes, colleagues, just let me get back to the pack. So I haven't done a summary presentation, but colleagues will have had time to digest the annual report and reflect on the volume of activity that has taken place in relation to safeguarding in Bracknell Forest from all partners and everybody involved in that process. So I'm not sure if there is anybody new on the call who's not familiar with the safeguarding arrangements in Bracknell Forest, but we do have a very active partnership, one that has been in place for quite some time, and during 24 did undertake a number of priority areas to ensure that it was fit for purpose for the future, in line with national changes and Working Together 2023, which brings a significant change to how we focus on children and young people as part of the safeguarding agenda. I'm not going to go through every page, but just to indicate we are in a period of time now presently coming up to the end of our strategic plan, which does finish in 2026. The document includes activity that we've taken place and reflection in relation to meeting the 4 key strategic priority areas that guide the work of the board. So Working Together 23, let me just explore that one with colleagues first. So by December last year, we needed to formally identify how we were going to meet the requirements of Working Together 23, which did require us to move to one of the statutory agencies chairing the Safeguarding Board. We, as a collective across East Berks, we had various different discussions, and locally we saw a clear benefit in keeping together the adults and children's perspective in our board, because as most people know, we do have a Bracknell Forest only board, and it is a joint board. Some of the work we've been trying to develop over time and still requires significant work is around transitional safeguarding. So that process transitioning from children's services, being a young adult into adult services, and with the difference in statute, ensuring we get that right. So we did focus on it in 24-25, but we're going to be further strengthening that in our new board arrangements through the commissioning of an independent chair for that subgroup, which is now in place. So just to reassure everybody, we're continuing to focus on that area. Another significant change and the work that took place during 24-25 in terms of the preparation for Working Together 23 was around ensuring that we have recognise our education leaders in their various different component parts, from early years to primary, secondary, independent schools, post-16. How do we get a full reflection of safeguarding in education built into the new board architecture? So we spent quite a lot of time during the year working through that. We commissioned a specialist, John Lefebvre, to support us with that work, and indeed we brought an independent person in to support us as a partnership to work through how we achieve that, and had a number of sessions to explore what that would look like. And we do now have, and in time for April 25, we do now have an education subgroup. That subgroup has clarified its priority areas, its terms of reference, and how it's operating. And John Lefebvre continues to support those education partners in engaging with the work of the board. And it is a developmental approach. And as we move forward, John Lefebvre will withdraw, and then our education partners will become an active member of the board, which they are represented on our formal executive board now, but even more so in the future. And so clarifying each time their work, how they're going to influence, and we're working through that. And it's very encouraging how engaged and committed our education and our broader education partners are. Some of the other changes as part of Working Together was formally acknowledging the chief execs of the various partner organisation as the lead safeguarding partners. So for us today, our lead safeguarding partner is Sue, and the most senior people both in the ICB and Thames Valley Police. And we have had one meeting in the 25-26 period, just to reassure people that we did meet the requirements of 24, where it's very clear that the statutory role of the lead safeguarding partners, which are then delegated to us as designated safeguarding partners, for which I currently now chair, as of the 1st of April, our joint safeguarding board in Bracknell Forest. What we have done is we have managed to retain the expertise and knowledge of the previous independent chair and scrutineer, who has now become the scrutineer. So his role is still embedded within our broader partnership infrastructure, as he attends and oversees a lot of the activity and the work to give that critique. And he's got a clear objectives and role as part of that, which we will review on an ongoing basis to ensure, as good practice guidance comes out about the role of the scrutineer, that we are adopting those, because we are expecting something comes through nationally or regionally in relation to that role. So that is in place and embedded. So just to give people assurance. In terms of any other supplements, just to supplement the activity in the document, I would say from the practice review activity, we've continued to focus. We have very strong subgroups and indeed a very strong and robust partnership. Philip Bell, who's here with us today, plays a very active role in the machinery of our safeguarding partnership, chairing subgroup activity, and also being a critical member in task and finish groups. So, for example, part of Working Together was to identify relevant agencies, and then the requirements of those relevant agencies in terms of safeguarding responsibilities, duties, and indeed what that means for us as a board in the local area. And Philip Bell and Devolve have been critical in supporting us in identifying those partner agencies, which has been wonderful, really, in terms of how that partnership comes together, and has been a strong part of how the board enacts. In terms of further areas for improvement, one of the areas that I'm acutely mindful of is that with this significant focus on lens on Working Together 23 and ensuring that we have this constant ongoing review of outcomes from the National Child Safeguarding Practice Review panels and the national activity taking place, which has tended to be on the children and people focus, in addition to the Working Together 23 requirements. We have had a very strong lens on children and young people. So we're just reflecting back now on how do we ensure that we continue to have a significantly that we strengthen our focus on adults, and it's clear within the work of the board. And one of the areas that we've recently been discussing is we don't presently have a Bracknell Forest neglect strategy for vulnerable adults. So that seems to be one of the areas that we'll be focusing on in terms of priorities and considering how we further have a more blended agenda going forward, so we continue to have that balance between children, young people, transitional safeguarding, and also adults in its various different guises across our broader partnership. So rather than continue to speak, I will pause there to see if there's any questions.
Thank you, Gurna. So we note the paper, and are there any questions from anybody about the paper? No? Good luck with your chairing role, Gráinne.
Thank you.
Yes.
And just to say, we are sharing it across the partnership. So Sarah Bellars, who's the chief nurse for Frimley, not Frimley, TVP, ICB, she's chairing the RBWM board at the moment. And we have Steve Ratfield from the police, who is chairing the Slough safeguarding board. So we've shared it out amongst the key partnerships in terms of our East Berkshire footprint.
Thanks very much. Such a vital part of our partnership working. Okay, just to give you a heads up that after the final agenda item, which I'm going to turn to Abby for in a minute, I'm going to be asking if anybody's got anything that they think partners should know that's going on in our own worlds or our own organisations. So be prepared, ladies and gentlemen. I will be coming to you after Abby's agenda item. So Abby, over to you for an update about the community strategy.
Thank you, Nicola, and good afternoon all. Good to see you, and always delighted to see Phil on the call, because Phil and I usually do a double act in presenting an update on the community's strategy. So just have a couple of slides to share with you, just loading those up onto full screen. Can everybody see those? Great, thank you. So just a reminder and recap that the community strategy is being produced with very much with the community, for the community, aimed at strengthening communities over the next 10 years. It's a partnership strategy focused on building resilient, connected and cohesive communities, and there's extensive engagement and consultation over the summer, and just wanted to recap on the next steps with the strategy development, because we're now back out to engage and consult with residents and partners on the draft strategy. So in terms of the oversight and governance of the strategy, it's being led by the community's partnership with a delivery group that is chaired by Phil. And we've got the active involvement of over 15 different partner organisations across the business, voluntary and community sector and public sector, actively involved in working together on the strategy. So I think it's the most extensive piece of co-production work that the council has ever been a partner in. Over the summer, we went out around the borough as a partnership and directly spoke to over 2,300 different people who all gave their views, and the partnership delivery group has been since September really reflecting on the rich feedback that came back from residents in terms of their thoughts on the strengths of the borough and what's working well, but also where we need to focus in terms of further strengthening communities and building resilience. So off the back of that feedback, the partnership group has drafted this vision for the strategy that we'll work together over the next 10 years to ensure that we further strengthen our community, ensuring everyone belongs, is listened to, is well informed and connected, that people can join in and help each other and take pride in where they live and work. And the feedback that came back over the summer, I think, is particularly heartening in terms of the positive feedback within that, around the extent to which people love living and working within Bracknell Forest. So lots of strengths to build on in taking forward the strategy as a partnership. Against that vision, or alongside that vision, the group have also drafted a set of aims and objectives. So there are 5 aims, 2 focused and particularly on looking at how we can develop more participative communities, encourage people to join in. The first one there around being connected and supporting each other to live well. And ensuring that people can join in and contribute to community life. And then some specific aims which are more focused on the cohesion element, so supporting people to get on well together, and ensuring that people have got fair access to opportunities and that everyone belongs, and that we can all take pride in and take care of our local community. So the partnership group is now out to consult on the vision, aims and objectives of the strategy, but also on the actions that we can collectively take to create the right conditions for delivering the strategy and further sort of strengthening and building that connection and cohesion across communities. So there's an online survey that's currently open, which we would encourage all of the partners on the call to complete and please sort of contribute to. That's being hosted on the Involve website, and the consultation's open until the 18th of December, if you'd like to give your views and feed in via the survey. But then in addition to that, partners are also out and about and organising, I think, 18 different pop-up events at high footfall locations across the borough. So they're out in supermarkets, leisure centre, some of the other sort of neighbourhood shopping parades right across the borough, from sort of north down to the south, to directly engage with residents who might not come along to community events or be motivated to complete the survey, to be able to talk to them face to face and ask for their views and thoughts, not just on the vision and aims and objectives, but also on how we can work together with residents and the kind of actions that they could take within their directly within their communities to support the development and the delivery of the strategy. So once the consultations close, we'll be obviously then, as a partnership group, refining it, and we'll be during the spring of 26 then presenting the final version of the strategy to the boards of the various partner organisations that have been involved in its development for endorsement, and we will be bringing it back here to the Health and Wellbeing Board as well for consideration and endorsement. So thanks, Nicola. That's all I'd plan to say, but very happy to take any questions. And I should probably ask Phil if there's anything that he would like to add to that.
Thank you, Abby. Yeah, I suppose just to the consultation, it's really the assurance, isn't it, that we've understood it's from our resident
Sorry,
population.
Phil,
So that's truly.
You froze for a second. Could you just start again?
Apologies. Yes, of course I can. So I was saying the second stage consultation is really a sense check to ensure that we've understood the messaging from our resident population correctly as we continue to take forward our work with our communities. Thank you.
And can I just check, would it be helpful for partners to promote that survey on their websites as well? So if we send out the slides, then if you haven't done that already, then that would be helpful. Fantastic. Any reflections or questions from anybody about the community strategy? I think it's such a fantastic piece of work, and ahead many other areas in the level of co-production that we're doing around it in Bracknell Forest. Charlotte, I was just wondering, and Abby, if you could describe how the community strategy and the refreshed health and wellbeing strategy are going to dovetail together.
We have had a number of conversations already about that, and I think timing wise it works well in that we're just starting the journey on the development of the health and wellbeing strategy. So we will be trying to ensure that where from the consultation results and all the feedback that we've got from the development of the community strategy is used as to inform the evidence base for the health and wellbeing strategy, and then ensuring that hopefully in terms of the principles for how the health and wellbeing strategy will be sort of developed and delivered, that sort of very much sort of working with communities, co-production, co-design, and a strength-based approach would be embedded into the delivery of the health and wellbeing strategy, so that they're mutually supportive and fully aligned.
Fantastic. Anything from anybody else? Okay, thank you, Abby and Phil, for all the work that you're doing on this as well. It's such a great piece of work. So I did give you a heads up. It's not compulsory, but this is the opportunity. If anybody's got anything on in their organisation that they want to share at this point, this is the agency update part of the agenda. Is there anybody that anyone wants to let people know is going on? Or Sue?
Thanks, Nicola. I mean, it was really just a nod to the budgets yesterday, and we had the policy statement for local government out the week before, and so we're still working through that policy statement to understand how the changes to the funding formula will affect Bracknell Forest Council's funding position. We know, as we talked about earlier on in the meeting, that we're moving to 3-year settlements, which is really helpful because it enables that medium-term planning. But we still really don't have much clarity on what our funding envelope is actually going to look like. So really, we're going to have to wait until the settlement, which is due just before Christmas. What I would just very briefly mention, albeit we have absolutely no detail at the moment, is the position on SEND funding, which at the point of the end of, and I never remember the word for it, the point of
the practice for Christmas charades, Sue.
Yeah, I know, I'm sorry, I just get a mental block on this word every time, but the override, statutory override, sorry. Thank you, colleagues, for your patience, but in effect, the funding that local authorities have received into the high needs block for SEND, they have been given a statutory override to basically overspend against that money, and against accounting rules. That was coming to an end at the end of 27, and would have put local authorities in a significant financial risk. Government are saying that they will then take on from that point on, after the statutory override comes into effect, when that's finished, they will then take on the full cost of the SEND costs. What that means in detail, we don't know yet, but it is a signal towards government's commitment on fixing the system and reforming SEND. So it's sort of a soundbite, I guess, of the direction of travel. A lot of work still needs to be done as to what that means for longer term funding, and what that means for the remaining deficit that will sit with local authorities.
Thank you, Sue, really helpful. And it sounds like good news, but you can never tell completely, can you, in terms of how good, until the detail is worked through.
Indeed, yeah.
Any other updates from organisations or people on the call? No? Good. Well, that means we've finished a little bit early. Well done, everybody. I think we didn't rush things. I hope you feel that you had enough time to raise questions if you wanted. And it means we can have a well-earned cup of tea before we go on to our next Teams call, or our children come home and it's tea time. So thank you very much, everybody. And the next meeting is on the 12th of February. So see you all then.
Thank you very much, Nicola. Thank you.
Thanks, Nicola.
Bye.
Thanks all.
Thank you, Nicola.